Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. Today I wanted to talk to everybody about acupuncture and dry needling and the difference between the two, right? So let's just start with a brief background history, okay? So up until 2020, every single acupuncture board, or most acupuncture boards in the country, were suing anybody else that was using an acupuncture needle and saying that they were performing acupuncture, right? So the acupuncture boards were suing the physical therapy boards, and the physical therapy boards, being the way they are, just decided to not fight at all for their practitioners, which is pretty typical. Reimbursement from Medicare has gone down 15% across the board this past year. It's gone down 21%, I believe, for physical therapy assistants. So just another example of the boards not standing up for their practitioners, right? So lots of states used to have dry needling, like Oregon. When I first got out of school, Oregon was one of the gray states, and there's still like 7 states like that in the country where they don't really have any statutes on dry needling specifically, but you can do it, you can't do it, they just don't have any literature on it. So Massachusetts is a state like that, which I think may have just gotten reversed. Wisconsin is a state like that, Pennsylvania is a state like that. Most of the states like that either had a gray area or that had a gray area and then banned dry needling for physical therapists, like a lot of the states did, they're now reversing course because in 2020, the AMA and Medicare made 2 specific CPT codes for dry needling, and they, in their literature, they specifically stated that dry needling is different from acupuncture. So now there's 2 specific CPT codes for dry needling. There's a CPT code for acupuncture, right? So that, legally speaking, basically put to bed all the lawsuits, because the acupuncture boards don't really have a leg to stand on, because of the AMA and Medicare made those codes, and because their initial argument is just absolutely ridiculous. So before I go any farther, I just want to make sure that this is clear. I love acupuncture, you guys. Acupuncture is really, really cool. There's lots of stuff that acupuncturists can do that I don't know how to do, and the reason for that is that the whole philosophy behind acupuncture is completely different than dry needling, right? So acupuncture is one of the oldest forms of medicine that we have recorded history of. It's been around literally for thousands of years, right? Thousands of years of acupuncture has been going on. So things that don't work typically don't stick around for thousands of years, especially things that aren't super duper expensive that people are just trying to make money off of, right? And acupuncture is not one of those things. So I know acupuncture works, right? I've had acupuncture, I've worked with acupuncturists, but unfortunately, the vast majority of people working in the medical field are completely uneducated in most of what they're doing with their patients, right? They may think that they're educated, but what these people do is they go through school, they finish school, they think they know everything that there is to know about everything, and then they never learn anything for the rest of their career, right? So when an acupuncturist comes to me and says, well, you're doing acupuncture, my initial argument, and the argument does not go past this because everybody that has at least one functioning brain cell realizes this, that if you're telling me that I, as a doctor of physical therapy or some other person, can perform acupuncture just because I have an acupuncture needle in my hand, you are admitting to me right now that acupuncture education is completely useless. Right? So we should just, before we go any farther with this conversation, we should make sure that we shut down every acupuncture school in the world, because if I can perform acupuncture just by having an acupuncture needle in my hand, right, that means that all of the schooling for acupuncture is completely null and void because I've never taken an acupuncture class, right? The argument on it at its base is based off of a complete fallacy, right? It's a self-deprecating argument that is delegitimizing the whole profession of acupuncture, which is really unfortunate because acupuncture is great, right? So one of the things that I hear most frequently from acupuncturists or from students that I teach that have some acupuncturist get a hold of them and start complaining about the fact that they're doing auricular dry needling or needling the ears, right? So this is another insanely incompetent, ridiculous argument. Okay, so just take a step back for a second. Can you imagine going to a plastic surgeon and saying that you can't treat the face because dentists treat the face, and dentists have been around longer than plastic surgeons, so therefore plastic surgery, orthopedic surgery, no other medical profession, right? Dermatology, nobody else can treat the face or the mouth because dentists were one of the first people that treated the face and the mouth. Can you imagine saying that to a regular doctor, the response that you would get from them? First of all, we should all be out to help our patients as much as we possibly can, right? That's the reason that you should go into the medical field. If that is not something that concerns you and you are fully willing to actively try to dissuade patients from receiving good medical treatment, that's just a really sad, unfortunate situation, right? So, ear needling. Let's just talk about the major differences between acupuncture and dry needling, right? So acupuncture, traditional Chinese medicine or traditional acupuncture was developed thousands of years ago before we even knew what a nerve was or a germ or a cell or how genetics work or inheritance or anything like that, right? So acupuncture is based off of a long-standing experiment, basically, and they have been smart enough to find certain pathways and systems that seem to be linked to each other. One of the things, and the primary thing that acupuncture does not have going for it, and Dr. Helen Langevin has been really good about writing about this. She works for the NIH. It's the only bad thing she has going for her. But Dr. Langevin, you do awesome research. I really love it. So Dr. Langevin has spoken about one of the major problems with acupuncture is that the whole basis of the acupuncture system and theory has never been scientifically proven. Now, I'm not saying that it doesn't exist, because I do think that the meridian system exists in a certain way. I just don't think it exists how acupuncturists think it does. But it's based off of a medically unproven, and at least currently with our current medical expertise, unprovable system of thought, right? So in acupuncture land, there's like 361 or 360 points, and there's 12 primary meridians. The meridians are the things that you hear about people talking about chi, right? So chi is in acupuncture world is the energy. So the meridians are 12 major energy pathways flowing throughout our body. They say that 6 of them are yin, 6 of them are yang, right? So that's kind of like the whole acupuncture type of deal. And I don't have the slightest clue about how to go about doing this, but acupuncturists learn in acupuncture school Eastern medicine techniques. There's different things about herbs and looking at eyes, and I don't know any of what they do except a couple of really basic things, right? They somehow determine which of the 12 meridians are off, or which ones are off, and then they use a combination of those 361 points to treat the meridians, to try to put the meridians back into balance, right? Now, I believe what traditional acupuncturists were figuring out was how to put the human body into autonomic nervous system homeostasis, right? So when I hear acupuncturists saying they're trying to balance the meridians, in Western medical science, what they're actually trying to do is balance the autonomic nervous system, right? But it's based off of a totally different system. So in dry needling land, right, we don't have any predetermined points. We don't talk about meridians. I don't know what the meridians are, or where they go, or how to balance them, or what they do, or what they affect, right? We are basing our needle placement on neurophysiologic, Western medical, provable science, at least as far as we know right now, right? Probably most of it will be proven untrue in the, within the next 50 or 100 years, but that's just how medicine goes in general, right? So we are using our needles as dry needlers to specifically target pathologic tissue while at the same time specifically targeting the nervous system, because we know for a fact that the vast majority of medical and mental health impairments are either the result of or cause sympathetic autonomic nervous system hyperactivity. That's just what the human body does in the process of living, right? Mental and physical stress, strain, and trauma and pain all cause sympathetic hyperactivity. The older you get, the more your sympathetics get elevated. So the vast, overwhelming majority of medical impairments are all associated with sympathetic hyperactivity. So this is why dry needling and acupuncture are such effective treatments in the right hands, because if you know how to use them both, or one or the other, you can really, really specifically target the parasympathetic portion of the autonomic nervous system, which is the opposite side of the sympathetics, right? So if the autonomic nervous system is a seesaw, and the little triangle thingy in the middle is here, right? As the sympathetics go up, the parasympathetics go down. And as the parasympathetics go up, the sympathetics go down. It's a reciprocal relationship, just like a seesaw. If one side goes up, the other side has to go down. It just so happens that human beings react to most stuff by elevating sympathetics. And if it's not properly treated or taken care of, both mentally and physically, right, the sympathetic nervous system gets stuck in hyperactivity, and that leads to widespread detrimental processes like hormone imbalance, decreased endogenous opioids, increased pain, all sorts of bad stuff happens, right? So we're both acupuncturists and dry needlers are trying to help their patients, right? In the United States, dry needling and acupuncture is not anywhere close to a mainstream treatment for anything, although it should be, it's not. So the more people, the more medical practitioners we have performing effective and safe needling techniques, whether you're calling it a dry needle, and there are some companies that are making things called dry needle, there's no difference. It's just a small, sharp piece of metal, right? We're all trying to help people. It's very sad to me, and it's extremely arrogant of acupuncturists to say that they have sole dominion on treating the ear, right? So for some reason, acupuncturists and physical therapy boards think the ear is like something that acupuncture only can needle. It's absolutely absurd, right? So the whole ear is filled with acupuncture points, and I don't know how to use any of them because they're all meant to balance certain meridians, right? The reason that I needle the ear is because it's innervated by 3 nerves, typically, right? The greater auricular nerve, the auriculotemporal nerve, and the vagus nerve. We know in Western medical science that the vagus nerve, a recent meta-analysis showed, they estimated that the vagus nerve itself contains about 75% of all parasympathetic fibers in the human body. We know it's the primary nerve of the parasympathetic autonomic nervous system. We know the vagus nerve innervates all of our organs, our heart, our lungs, our kidneys, our liver, right? It innervates our intestines. It's extremely, the parasympathetic portion of the autonomic nervous system is extremely important for pelvic health, both male and female. It's the primary reason that people get erectile dysfunction, right? So scientifically speaking, we know that vagus nerve stimulation is extremely homeostatic and healthy for the human body for the vast majority of humanity, right? Although I really, really dislike the FDA and the CDC, those are the agencies that we got, right? So vagus nerve, electrical vagus nerve needling, at least a surgical procedure, and this has been compared to the auricular procedure in recent meta-analyses. Vagus nerve stimulation, where they put a little metal wire around typically the left vagus nerve itself, that's FDA approved for anxiety, depression, epilepsy, right? It's being studied for chronic pain, obstructive bowel disease, IBS, all sorts of things. And the reason that it works for such a wide swath of medical impairments is that overall, our body and brain know how they should be and how to heal themselves. What happens is that they get inhibited from doing so. So by stimulating the vagus nerve itself, that's the most powerful treatment that we have to specifically elevate parasympathetic autonomic hyperactivity and depress sympathetic autonomic hyperactivity, which is what we need to do to bring the vast majority of people to autonomic nervous system homeostasis to allow their brain and their body to heal themselves. So if you're living with chronic sympathetic hyperactivity, that leads to excessive cancers, higher likelihood of cancer, cardiovascular disease, high blood pressure, autoimmune disease, chronic pain, tissue hypoxia. It leads to all sorts of bad stuff. Anxiety, depression, right? Dopamine dysregulation, beta endorphin depression in the body, right? GABA goes down, glutamate goes up. All these things that stimulate our brain and make us into fight or flight response go up. All the relaxing things go down more or less, right? And everything dysfunctions. So I always say in all of my classes that if I had to pick one location only in the body to needle, it would without question be the ear, because the concha, the symbiconcha of the ear, and the inside of the tragus are all typically innervated by the vagus nerve, right? So that is the most direct parasympathetic treatment in the body we can use. I use it with 100% of my patients. I believe the acupuncture point in the concha of the ear is called MCO-1, I believe. I'm not 100% sure. That's mostly right. MC-1 or MCO-1 or something like that. That's all I know about that. That's part of some meridian. They use it to balance that meridian, right? When acupuncture was invented, they had no idea what the vagus nerve was. They had no idea what the autonomic nervous system was. And that is not a part of traditional acupuncture education. And acupuncturists, most of them do not know very much at all about anatomy, because it's not necessary to know anatomy for acupuncture. They're not basing anything they do off of anatomy, right? They're basing what they do off of a medically unproven system of meridians, and they're trying to balance the meridians. Now again, I believe the meridians exist, and I think they're onto something, and I use a lot of that kind of thought process when I'm treating people, because you really should overall try to remove as much tissue pathology from the body while at the same time targeting the parasympathetic portion of the autonomic nervous system. Because remember, every tiny little millimeter of short contractile tissue or short tissue that we have in our body is going to either consciously or subconsciously send negative afferent stimulating signals to the sympathetic autonomic nervous system. So enough little bits and pieces of tight tissue anywhere in the body is going to elevate the sympathetics, right? So an overall treatment strategy for all physical therapy patients should be reduce as much tissue pathology throughout the body as you can, while at the same time targeting the parasympathetic autonomic nervous system as much as you can. So the most powerful parasympathetic treatment is the ear. It's the most direct. It's the only part of the body we have to needle that's innervated by the vagus nerve that we can treat safely, right? The other areas would be the upper cervical spine, like C2 spinous process, base of the occiput to get stimulation on some of the cranial nerves, and then the sacral plexus, S2 to S4, parasympathetic dominant, innervates all 9 or so of our pelvic floor muscles, right? So I utilize those 3 locations with as many of my patients as I can. So when an acupuncturist comes to me and says, well, you can't needle the ear, number one, acupuncturists and acupuncture boards have 100% zero ability. They have zero ability, right? This is so arrogant. They have zero ability to tell any other profession what they can or cannot do, right? Number one, physical therapists are doctors of physical therapy nowadays, right? There's very, very few acupuncturists with a doctorate degree, so we have a significant amount more education than they do. In acupuncture school, I can teach anybody to poke a needle into somebody. That is not hard. A 5-year-old can do that. What is challenging is knowing how to do it safely and the reason that you're doing it and what you're trying to accomplish. Again, acupuncture is great. They're trying to accomplish, I think, the same overall goal, which is autonomic nervous system homeostasis, but they're just going about it super differently, right? So like a lot of traditional Chinese acupuncturists are going to treat the ankle while they're treating the shoulder, right? It has to do with the meridian system. I don't know how that works. The way that I needle is based on the neuromusculoskeletal system, which is provable, objective Western medical science, which does not play a role in traditional acupuncture, right? So again, to go for imagine as a physical therapist going to a plastic surgeon and saying, oh, no, you can't treat that part of the body, right? It's absolutely absurd. So if you're saying as an acupuncturist that anybody with an acupuncture needle can perform acupuncture or is performing acupuncture, you are admitting right there that the entire profession of acupuncture and all the schooling for acupuncture is completely useless, right? That's what you're admitting. So I challenge any acupuncturist out there, if you want to have a video debate with me, we can get a moderator, I would be more than happy to do that, but I would really like to put this to rest, because what it's doing overall is inhibiting our patients from getting better, which is completely unacceptable, right? The more people that needle well and safely, the better we're all going to do.